One quick question here. When someone shows up to a doctor's appointment or anything medical and they have a case manager with them, what's the treatment look like? Not how are they treating them, but how are they treated by the physician differently?
So it's a good question. Usually, as case managers, we have a relationship with the doctors, with the office managers, with the nurses there. So we're usually able to kind of get quicker appointments, get quicker answers, get things done faster, get people into MRIs, therapies, coordinate all that kind of stuff. So it does definitely expedite the process for the patient, which if they're a motivated patient is a good thing. If they're not a motivated patient, then they don't like things being expedited through the system and getting, good care and getting it quickly. So it's slightly different. Sometimes you're dealing with people who want to go back to work. Other times you're dealing with people who no way want to go back to work and will trump up their, diagnosis and their different kind of pain levels and things like that. So you see the whole spectrum for sure.
Okay. But are people, again, they're treated better? I've heard tons of stories of people being gassed by their medical providers, or shamed or yelled at or all kinds of stuff, really not helpful kinds of things. So I heard that with the case manager, they're treated better.
Yeah, I mean, a lot of what propels me now is the concept of advocacy. So as a case manager, you're an advocate for that injured worker. So most times you are getting a better result. You're getting the doctor to better focus and slow down and take time with that patient than if you weren't there. I found that to be true.
Are they won't say with the case manager there? How do you make sure the interaction still goes well? Maybe the doctor holds back or doesn't say things they would normally say if the case manager is there because they're worried about liability. What have you observed?
I have seen it go lots of different ways. Most times, like I said, we have a rapport with those doctors, so we've worked with them for a while. So they, understand us, we understand them. Sometimes as a case manager, you meet separately with the doctor, one-on-one. And sometimes the doctor is freer to discuss things of what's going on. I've noticed that if your doctor's a good doctor and is really secure with themselves as a person, as a doctor, when you recommend things or when you suggest possible second opinions or things, that doctor will say, oh yeah, it's a great idea. I would like to see what that other doctor has to say. Whereas if you have a doctor who's egocentric, who, feels very threatened, they're going to take the other approach and they're going to say, well, if you're going to get another opinion, then I don't want to treat you anymore. So I really feel that your better doctors really just don't have any issues or concerns with somebody else being there. It's the doctors that are either sometimes newer or the ones that have been burned before legally from attorneys and other kinds of issues that are a little bit more on the, defensive when it comes to case managers.
Okay.
So I started my company and I grew it to about 300 case managers. And then I sold it to another company, the IMA Group, fabulous company. And I've sold it now almost 3 years ago. And I'm still working for that company. I'm VP of Business Development, doing higher level kinds of things, working with clients, still working with case managers, supervising them on some levels, doing a lot of training, presentations and things. And then about 6 months after I sold my company, I got a cancer diagnosis of AML, acute myeloid leukemia. Came out of nowhere. Also, it was found I had no symptoms. It came strictly from blood work. So cautionary tale, make sure that you do your blood work and your physicals and do everything that you need to, because sometimes things will come up that you are not even aware of that you can get a jump on. So that was a real life-changing moment, obviously, for me. And I went through treatment, extensive chemotherapy, extensive hospital stay, and then I had a bone marrow transplant, and I did really well. But then about 4 months after that, I relapsed, and now I'm on maintenance chemotherapy, and I am cancer-free. And it kind of propelled me to do what I'm doing now, which is my passion work, which is advocacy for those people who have cancer. And I'm writing a book about how to be your own advocate as you go through a cancer diagnosis. And it's not just for patients, it's for caregivers, friends, providers. And I'm also doing coaching and speaking about how to be a warrior and be your own advocate